What's up, y'all? Happy Saturday. Welcome back to another episode of Life of a Single Mom with Brittney
and Creasha.
And you guys, today's episode is episode 15. Can you believe it? We made it this far with 15 episodes in.
Wow.
And for all y'all that's following us and tuning in to our episodes, make sure you're listening on Spotify too so we can get some traction run up over there. This week's episode is going to piggyback off of last week's episode where we discussed sexual abuse and different STDs. So this week, with Creasha being in the medical field, she's going to discuss different conditions that we as women face and just some informative information that may help you or someone you know dealing with these. So Creasha, take it away.
All right. Hi, guys. I hope you guys had a great week as usual. I'm going to bring it with prayer, like always. I'm going to bring y'all a little scripture. Isaiah 40, verse 28. He gives power to the weak, and to those who have no might, he increased their strength. You got to trust in God. You got to believe in God. You got to make him a priority in your daily life. You know, like everything that we do on a daily day basis, we have to make sure that that's one thing that we do. So everything that we have in our life going on will align with the Spirit and align with his will for our lives. All you got to do is call on him. You know, you got to pray really and worship, and you got to make that time to spend with God and give him his props like you give everybody else their props, basically, you know, and he gonna come through for you at his own time, the time that's right, not too soon, not too late, just on time. I wanted to talk to you guys about health this time around because I'm noticing people around my age. I'm going into my 40s next month, and we don't talk about these things. Like, I'm so glad that I decided to be in the medical field and I happened to go to an OBGYN because I'm learning so much about the woman's body. Like, these things were foreign to me before I stepped into this field. And I just wanted to enlighten you guys and let you know that you can talk to your doctor about things that you feel. You don't have to feel embarrassed. You don't have to go your whole life being naive about things that you should get those pamphlets on, that you should be worried about, you know. For me, I don't know my family history. You know, I don't really know a lot about my mom or my dad's family besides what certain people have told me. But you want to know about your family history because that's going to help you with things that you go through, because some stuff is hereditary, is in the family, you know. And uterine fibroids is something that I wanted to talk about first because a lot of women in their 30s and 40s have these, you know, and it's a lot of us out here. Uterine fibroids are muscular tumors that grow inside the uterus. It's the wall of the uterus. And most of them are benign, but they possibly could be cancerous, but rare. Not all women who have them have symptoms, but the women that do have them, they have, you know, things like heavy bleeding. They have things like painful periods, pelvic pressure. When you feeling like you got some cramps, but they like extreme, you might want to check out and see if you have fibroids. You know, like you can have frequent urination because sometimes you have fibroids that are so big, they pushing on your other body parts and organs and stuff like that, growing, you know, on top of certain things. So you want to really get a transvaginal ultrasound to see if you have that type of stuff. It also can cause your stomach to become big. I know I've met quite a few people at my job, you know, that have large fibroids, and some of them have to get them removed. So you want to check these things. Constipation is another thing, you know, And with constipation, that's kind of gonna cause another problem. Like if you a person that's strained when you go to the bathroom, it's a problem. You shouldn't have to do that, you know. So you want to get those things checked out. And then also you can have pain during sex because again, it can grow so big and it be in, you know, certain other places, and now you having pain because you have this thing growing in you. But if you don't get them right tests, you'll never know that. You just gonna deal with the pain and not know why. Um, Types of fibroids. Intramural fibroid is a growth within the muscular uterine wall. So that's like actually right there within the uterus. Submucosal fibroid is like a bulge in the uterine cavity. So those are like growths on the wall but not in the wall. Um, Subserosal fibroids are the ones that form outside the uterus. So those are the ones that can grow large. Um, Depending on the type you have is depending on some of your symptoms or where they are. That depends on your pain and where your pain comes from, because people have low back pain, people have, you know, leg pain. It's all kind of pains that I done seen patients come in with, and it's fibroids, you know. Some of them are small enough to not be bothered. They don't usually bother them unless they bother you. So if you have small, like I know I have a few small ones, like several, so probably like five or six, and they are small, but they do cause me to have heavy periods, back pain, really bad cramps, you know, extreme fatigue because of the bleeding. I have to take iron. It's a whole lot of things that come with that. You know what I'm saying? And people think like, damn, you know, like all of that. Yeah, you may or may not get it though. Um, when you need to see your OB, when it's like serious, it's gonna take you to the hospital. It could be, you know, if your pain is extreme like that. Pelvic pain that don't go away, you definitely want to go see what's going on, you know. And sometimes I recommend, if your pain is too bad, that you go to the emergency, because if you go to the doctor, they gonna have you, you know, get a referral, and then you're gonna have to make an appointment, wait for that appointment, get all of that stuff. If you go to the hospital, get a, you know, a pelvic ultrasound, they can see right there, and then they'll have you follow up with your doctor, and that's skipping a step. So then you can go with that ultrasound report and see what's the next step for you based off of the size and all of your symptoms. um
Now, let me ask you this. With that, because all of those that you described, they all like happen within the uterine walls, outside the uterine walls. So do any of those cause or impact the ability to have children?
they don't really impact the ability to have children unless they are like on pushing on certain organs like fallopian tubes, you know. They don't call, I've seen people get pregnant and have those, you know, like big ones. So it just depends on where it is exactly, because you can have a full pregnancy with those in you, and they just watch you closely to make sure, you know, nothing is extreme. But you definitely could have kids. And then some other stuff that they cause is like heavy bleeding, spotting in between your periods. Like you might go 5 to 7 days, but now you done stopped your period, and then 2 days you don't have no blood, and then the next couple days you have some spotting, and then it stop and come back. That type of stuff. The fibroids is pushing on your lining and it's causing that breakthrough bleeding. Um, you can get tired, really tired, weak, have anemia, your blood is low, and then you have to take iron. I've seen patients, you know, they iron so low they have to get iron infusions because the pills ain't working. You know, stuff like that is just really important for you to know, because if you losing blood and you don't even know why, you need to check. I mean, and some people they'll say, "Oh, I've been bleeding like this for 3 months." Like you gotta do better than that with your own health, you know. Um, as you go into menopause, though, if you have fibroids, they do shrink. They do shrink. But if you have severe symptoms, you can talk to your doctor about getting them removed. I know somebody that has had them removed a couple of times, and they finally just had to have the whole uterus removed because it was just too much to go back and forth through surgeries, you know. So that's pretty much my next point. A hysterectomy. Hysterectomies are when they either removing your uterus, they removing your cervix, they can remove your fallopian tubes and your stuff all together. They can do like the fallopian tubes, the ovaries, they can do the cervix. Sometimes they leave cervix. It's all depending on what your situation is. Like, don't think because you have heavy bleeding or you have fibroids, don't just let them give you a hysterectomy, because sometimes you need to just sit down and be evaluated and see what's the best step for you, you know, because um it has a lot to do with your estrogen levels, which is the strongest hormone in a woman. You know what I'm saying? That's the most important. That's the one that's going to give you the drive that you need to do all the stuff that you need to do. If you don't got no estrogen, you ain't going to be wanting to do nothing. Have no sex, you ain't going to, get up and do nothing. You could go into depression, all that stuff. But a total hysterectomy is when you're removing the uterus and the cervix, but they leave the ovaries. A super cervical hysterectomy is when they remove the upper part of your uterus, but they leave the cervix, and you still need to get pap smears because you still have your cervix. A total hysterectomy with bilateral oophorectomy. That's a long word. I had a hard time saying that when I first read that, but it's the removal of the uterus and the cervix. Fallopian tubes is salpingoectomy, when they remove those fallopian tubes, and ovaries, if they just remove those, it's oophorectomy. Removing your ovaries will make you go into menopause though, because it's like removing your hormones that you need. So you will start to
Hence
have.
why they call it menopause, huh?
Yep, exactly.
Yeah, because you don't got no more of the hormones for a woman, so
Yeah,
it's
you don't.
menopause.
You
Yeah.
don't have no, you don't. You really don't. A radical hysterectomy with bilateral salpingo is when they remove your uterus, cervix, fallopian tubes, ovaries, and a upper portion of your vagina. Now that's usually, and sometimes they'll do the tissue and the lymph nodes around it too, which is when you have some cancer around that area. Like if you have uterine cancer, cervical, all of that stuff, they just remove it all so that it doesn't grow anywhere else. You might want to make sure that you understand how your period works, because if you don't understand how your period works, and I'm not saying you have to track it all the time, but you can kind of get a ballpark figure if your stuff is coming regularly, and if it's not, you need to check. I noticed that doctors have the ability to put you on a certain type of medication if you have abnormal bleeding, to pretty much make you stop bleeding. Like they can use things like progesterone to start your period. They can use estrogen to help regulate your period for a week. They could do Lysteta, that's to make your heavy bleeding slow down to be just, spotting or normal flow. Some people take birth control a certain type of way and it stops their periods from coming at all. You know what I'm saying? Which is not really safe, because you are supposed to shed your lining of your uterus every month. And if you don't shed it, it just get thicker and thicker and thicker. And that's when you start having these long month periods, and you'll have a period for this week and then a week off, a week on, 2 weeks, like it'll just be all over the place. So I don't really recommend that you use all of those medications to try to help your bleeding. I think you should just get your ultrasounds and talk to your doctor about something that you can do kind of naturally. I do know that they do IUDs to try to help
That's what I was
with
just
that.
about to ask you,
Yeah.
since what about those? Because some women don't have periods on the IUD, and if they do, they may not have one for 6 to 8 months, then one pop up out the blue. Now, I heard you talk about the lining building up since it's not being shed every month. Is that safe?
Well, it is safe because the hormones that are in the IUDs are way less than what's in the pill. And I'm still kind of confused on how that works, but I do know that I always hear that that is not even an equal portion of how much the hormones are in them pills, so it keeps the lining from being so thick. But sometimes
Oh,
when you
okay.
need to have a period, you usually have a period.
Mm.
If you don't have the Paragard, because if you have the Paragard, which is non-hormonal, it will cause you to bleed a lot. So if your periods are like 7 days already, you probably gonna go like 10 or 12 on the Paragard.
Mm.
So I don't even recommend that one. But some women do get it because they rather have all the bleeding than to have hormones in their body. I'm one of them people. That's why I got my tubes tied because I didn't want to take no birth control. But the next thing I wanted to talk about was perimenopause and menopause. And I'm talking about this because I'm going through these things currently. Like seriously, this is something. Perimenopause is the part you are in when you transition it into being menopause, and that means no periods, no estrogen, none of that. You ain't gonna have no progesterone. You might have low testosterone, which is gonna cause you to have decreased libido, which means your sex drive is gonna be like this. I find that hard to believe with me because my sex drive is like over the fucking roof. But um
So your sex drive gonna go from up out of the roof to
down the ground, huh? And
he's gonna go to him. That's it.
perimenopause mean you in the ending stages of your reproductive years, meaning no more babies if you tried. You may notice this in your mid 30s to 40s. Some people in their 50s because they started menopause late. That all depends on mom. If your mom started older when she was older, you probably start when you older. Kids today probably gonna be forever in perimenopause because they start in their periods crazy. The levels of estrogen is a well needed hormone for the woman's body to function properly. And lack of that, testosterone, progesterone, all of those things throw us off balance, And it could cause shorter periods, longer periods, lighter periods, heavier periods. You can even skip periods, a month, 2 months. You can go 6 months without a period and then have another period. It just depends. You could go 1 month without one and then have two for the next, straight. But you just have to get those tests and see where you stand. Some people have real problems during this stage and they do need medication and additional attention because it messes with their quality of life. You could have hot flashes, you could have night sweats. I know I'm dealing with that tremendously. You could have problems sleeping. You can have them mood changes and be irritable all the time. Increase anxiety, depression. Your vaginal area can be dry. Your sex drive can go down. And when your vaginal area is dry, no lubrication down there because of your hormones changing, you are prone to bladder infections, and even in perimenopause, you have urine incontinence, and that is urine leaking. Like you ever sneeze, cough, or you smoking a blunt and you cough too hard and you got some pee squirting out, that could be a cause of that too. The tissue is thin when you going into menopause, and the tissue of the vagina can break. Like if you have no lubrication down there, if you're not getting wet no more, it's gonna cause friction, and when you have sex, it's gonna cause superficial cuts, which is fissures, and you're gonna have to use some type of estrogen cream or some ointments that helps heals those cracks because it can cause yeast infections and just bacteria, staph, all kind of stuff can be down there. It's going change your desire for having a baby. Even if you are able to have a baby, you might have thought you wanted one, but you go into perimenopause, you still got some eggs left, but they not as good as they used to be. You know what I'm saying? So you want to hurry up and have a baby before you get to that stage, or you might have a problem with getting pregnant. um it can change the sexual functions you used to. Like, you could probably be a person that got a high sex drive, but because you in perimenopause now, you don't even want to be touched. You don't even desire to even go there, and they have medicine for that if you need it. I didn't even know this one. You can lose your bone structure. Like, your bones can become weak because your estrogen is declining, and you need that. You got to take the proper vitamins. I swear, I'll be at work looking at these people, and I be asking them when they tell me they take all these vitamins. I'll write them down to see what they are, because we are lacking on that type of stuff. And when you get older, you need that vitamin D in your bones. You need calcium. You need certain things, but you got to know, oh, if I have too much calcium, what's going to happen? You got to know that that's going to cause some problems up here, if you having calcium, too much of it. So you take your vitamins, but make sure you pay attention to the guidelines that's strictly meant for you not to overdose on those things, because too much calcium in the body, too much vitamin D, then you over. So you want to be cautious of those things and know the right stuff to do when it comes to your health. It can even cause cholesterol changes. And I tell patients all the time, like, sometimes when you have high cholesterol, it's just a matter of you changing your diet. You have diabetes, it's a matter of you eating right. Like, if you change certain things that you eat, half of these problems people wouldn't even have. But we eat the wrong stuff. We don't eat enough vegetables. We don't get enough fiber. We don't eat the right things that we supposed to eat for our heart to function the way it's supposed to. We don't, you know what I'm saying? We clogging our arteries with all of this greasy food and all of this, you know what I'm saying? Cholesterol. You eat a lot of butter in your food, you're going to have problems. Look at the sodium in the back on the directions. You know what I'm saying? Like, it tells you everything that's in there on the package in the back. And you see this stuff all the time, but who actually takes time out to read the ingredients into this stuff and go look at what we should have in our body and how much of it should we have? If you're not looking at your stuff like that, then you definitely probably eating the wrong stuff. You definitely probably feeding your kids the wrong stuff. And we all guilty of it, because we eat the stuff we like. We don't eat the stuff that's necessarily good for us. We eat what we want because we have freedom. You know what I'm saying? We don't pay attention to actually doing it the right way. Like, when you go to the store, you just looking for what you're looking for. You're not trying to see what vegetables you can incorporate in a new dish, or what, you know what I'm saying, new seasonings you can try to do into a new dish. Like, I always try to make something new, but I still revert back to the stuff that I always like because it's safe, I guess. Gotta have my chips, gotta have my soda. But not since I've been on this journey. I've been trying to do better. But did you have any questions or anything about this one?
No.
Another thing, when you guys have pelvic pain, when you go to the doctor, you have to make sure that you ask them to check and feel on your organs to make sure that you don't have a PID, which is a pelvic inflammatory disease. And sometimes you can think you have a bladder infection and it really be a pelvic infection, and you can't understand why you getting treated with certain antibiotics and nothing's happening. You have to be aware of your body and the things that causes you pain. Like, some of us don't even know where our bladder sit. Some of us don't even know where our ovaries are. You know what I'm saying? If you've had a baby, you probably 9 times out of 10 know. But a lot of people don't know these things. So urinary tract infections, they turn into kidney infections if you don't treat them. If you have any burning with urination, you have any odd blood in your urine, any cloudy urine, foul smelling urine, you need to go get checked for a UTI. You have low back pain, you got to figure those things out, because you shouldn't be having that type of pain. You shouldn't be having burning when you urinate. When you pee, you shouldn't have no problems. You should just be able to pee and no problem. Like, if you have any outside itching, any irritation in the vulva, the vagina area at all, you have to go get checked out because yeast infections, bacteria vaginosis, those are things that women constantly can get and nobody talks about it. And I'm only bringing this up
Not only
because,
that, um, all those things that you was talking about for like the UTI and the bladder infections and stuff like that, all those symptoms are symptoms, like you said, with kidney infection, but kidney stones as well.
yeah.
You'll have like lower flank pain and you'll think it's like a bladder infection, a UTI, but you have to make sure these doctors are testing for everything, like Creasha
Mhm.
said. Don't let them keep, if you know you keep having this same problem, don't let them keep sending you out of there every time telling you, oh, it'll go away with this. No. You
Mhm.
tell them, no, I'm not leaving here until y'all check everything.
Exactly. And that's the truth because sometimes based off of your symptoms, they'll think it's one thing and then they'll just go ahead and, give you the medicine based off of that symptom. But it's a little deeper than that, because like she said, you can have kidney stones, you can have a kidney infection, or you can have a UTI. But if you don't check all three, how you gonna know? Because sometimes you could have a kidney infection but still have a UTI. You know what I'm saying? And it's just a little deeper than just the UTI. So you can have those, like some people can have bacterial vaginosis and yeast infection, but the truth is, if you don't treat both of them, one of them ain't gonna go away because both medicines are different. You know what I'm saying? And the treatment is different. So if you taking BV medicine and you got a yeast infection, that yeast infection ain't gonna be gone. If you have a UTI and you take those antibiotics, you might be prone to getting a yeast infection. So you might want to talk to your doctor and tell them to just prescribe you both medicines, like be preventative, prevent the stuff from coming and you happen to go back to the doctor and do all the extra stuff. Just if you know that you usually get a yeast infection after you take antibiotics, just go ahead and get the antibiotics so you have both, and when it happen, you got it there. But if you the type of person that has yeast and drips down there out your cootie cat and you don't go and get checked and you just think it's normal, then I don't understand. Like, don't come 2 months later and think somebody supposed to work miracles after you've been scratching and doing all this stuff. Like, if you feel like something is off, I say go get checked, because 9 times out of 10, you know your body and you wipe yourself every day. So you know what's normal and what's not normal. So there is no mistake when it comes to going to check yourself and making sure that you clean and you right, because don't nobody want to deal with that. You got to make sure it's right and proper. You know what I'm saying? Like, clean yourself, be clean, talk to your doctor, get you a doctor that you could be stable with, and they know your body and they know your history of your body, and that way y'all can always determine what is the problem. If you keep going to different doctors and trying to get this done here, that done there, no one actually has your track record to know where you stand with what, and people are not always honest when they go to the doctor. That's another thing. When you go to the doctor and you talk to them, you got to be honest with them, because how can they help you properly if you lying or leaving stuff out? If they ask you certain things, you got to tell them the truth. Like, I know a lot of people have genital herpes and they don't even tell the doctor. You know what I'm saying? Like, we have to test you and then just find out. Like, you could have just told us if you already knew. It makes no sense to not get it taken care of if you already know where you can get it done. These things are very important, and a lot of people, I don't remember talking to my mom about this at all. I didn't talk to her about periods. I didn't talk to her about, heavy bleeding, pelvic pain. I didn't talk to her about any of this stuff. When stuff happened like that, you just try to figure it out. Before I worked at this job, I wouldn't even think about going to the doctor. Like, every once in a while I would get a pap smear, but I wasn't getting a pap smear like every year like people do. Like, I see these people, some people come to the doctor every year and they get their blood work, they get everything done and know what's on their people. Some people come with folders of all their medicines they ever took, all
Yeah.
they everything. You know what I'm saying? I'm like, man, I need to do that and enlighten my
I've
sisters on
got
doing that. Huh?
I've always gotten my pap smears every year as well too.
Yeah.
As far as everything else, like you said, is being checked for everything. I don't do that every year, but
Yeah.
yeah, the pap smear thing I've always done every year.
Yeah. That's an important thing too, because pap smears are what helps you find other things. Like when you get a pap smear, people tell you like, "Oh, you just get a pap smear, so it's a checkup, an annual," but they don't always tell you the meaning of getting a pap smear. You know, like when you sitting in that thing, it might feel a little weird. It really might feel a little weird if it's odd to you, you know, if it's your first time or something. But I'm telling you, you need to get that pap smear, because if you having sex, and unprotected sex at that, um you need to let them do that swab on you, because that is going to help them check for cervical cancer. It's going to help you find out if you have HPV, and it's so many strands of HPV. It's so many. Like even when you get the vaccination for HPV, it's not going to cover all the strands that are out there. I do know that HPV has three main ones that causes cancer, which is the 16, the 18, or the 45. Those are the ones that really cause cancer. And if you have one of those, you usually get something called a colposcopy first, which is she will look at the cervix and the endocervix, that's the inside of the cervix. She will look at that with her little scope, and she will clean your inside of your vagina and your cervix and all that with vinegar. And if it is some precancerous cells, we call those dysplasia. And if she see it, it will pop out as like white. It will be like little white freckles. And she will take her biopsies and do that. And then she'll send it to the lab. And in the endocervix, she also checks that to see if it's any cells hiding there. So she'll scrape the endocervix and then put a little paper in there and collect all the stuff that she scraped off. If you do have precancerous cells, your next step, depending on your results, how severe they are, she will either do a freezing, which is a cryo. She freezes the cells on the cervix, and then they fall off. Like they all fall off like little skin shedding off of your body. And if it's really severe, it will be to where she sends you to the hospital, and she does a surgery, and she cones all the dysplasia that she sees out. So like you'll get a surgery, and she just takes all the cells out. So wherever they are in there, she just takes it all out. She cores it out. And you have to get your pap smears every 6 months to make sure it's all gone and it doesn't come back. Um I didn't even know that HPV causes warts. Um, they can be on your genital areas. They can be on the top of your private part. They can be in your anal area. They can be in the cervix. It could be wherever. Um, Common warts. These are some things I learned. Common warts on your hands and your fingers could be a form of HPV. So sometimes when you see people having those things on their hands and fingers, that can be a form of HPV. Plantar warts, they are on the heels and balls of your feet. They are also a part of HPV. And then flat warts, they can be flat wherever they want to appear. They can appear anywhere. And the craziest part is if you have HPV or genital herpes, you have to get treated in order for your kids not to get it. And with HPV, sometimes your kid can get infected in their throat, and they have to have surgery coming out. So you definitely want to check for pap smears, because it's important for you to get this knowledge and know where your life is, because a lot of people have it, and men are not tested. They don't have a test for men. So I'm talking to the women out there. I don't care what age you are, what race you are, none of that. If you haven't unprotected sex, you better check your partner and make sure that you ain't getting that, because that is something that you cannot get rid of. And another thing, HPV virus, I didn't even know that it can come from like a cut or abrasion or a small tear in your skin. Like, primarily it's skin to skin contact. Um, that's like the surface HPV basically. Genital HPV is from sexual intercourse, anal sex, skin to skin contact, any genital region, even oral sex. You can get HPV in your throat. You can get HPV in your mouth. If you sucking on something and it got HPV on it, you can get that in your mouth. Um, Warts are contagious and can be spread through direct contact with the wart. Like if somebody had a wart and they touched a certain spot, if you go behind them and touch that spot, you can definitely pick up that virus. That is so crazy and it's so scary because I've always been the one to tell my kids when we outside or we going somewhere not to touch everything. You know how your kid just rub against the wall while y'all walking or holding on the gate, touching all this. You know, I always tell them like stop touching that stuff. You don't know who been on that. You don't know what they've been on, you know? So you definitely gotta pay attention to the things that you do and know the partner that you have because those things are silent, man. Like HPV and genital herpes are so high volume when it comes to how many people have it. And nobody tells nobody. You know ain't nobody gonna go up to nobody and just be like, oh yeah, you know I got herpes 1 or I got herpes 2. You still wanna date me? Ain't nobody gonna do that. So you gotta take the necessary steps to make sure that you are protected. You know, if a person is good enough to lay down with you with no protection, they definitely better come with their paperwork and let you know that you still protected, you know, because I ain't trusting what nobody say no more. I'm not doing that, you know. You got to really make sure that a person is, because it's so many STDs out here. Like I'm just now hearing about some stuff called mycoplasma and uroplasma. And what it is if they check you for all the infections, they go to those because those are just like rare infections, but they new infections. So if you don't got this, they think, okay, we checked you for all this, you have to have this. You know what I'm saying? And it's crazy because it's a whole thing to do that test. And I'm so like, oh man, we gotta do them now. But it's just these generations are not educated about these sexually transmitted diseases, nor are they, you know, educated about getting their pap smears and checkups and stuff like that. You know, breast cancer. Those things are important to know. Like when you should go and get your breast checked. Like everybody say, oh, okay, we got to be 40 to get a breast check. We got to do this, we got to do that at 40. No, now they saying 35, but I'm telling you, I don't care if you 20. If you feel something going on with your breast, you go have them people check that out. You know, I don't care. Ultrasound, they gonna do that first if you're not of age to get a mammogram. Insurance might not cover it unless it's something worth covering. You know, like if they do an ultrasound, see a breast mass, then they might cover the actual mammogram. So they'll send you back. But I know you have to pay attention to if you have any discharge in your nipples. You have to pay attention if you have breast pain in your outer part. Like, have you gained weight? Have you lost weight? Because that's the first place we gain is in our breasts. And if you gained weight or lost weight, then 9 times out of 10 you might have some pain there. If you drinking coffee, you drinking tea, that's gonna basically have your breast a little sore sometime. Or you might be a person that get breast pain during period time. I know I do. But those are things that you need to be enlightened on. Like, I don't want to be naive. Like, I don't have no daughters, but I have a couple nieces, and I would want to educate them with things that I know so that they can protect themselves in the future, because there is no way that our mom shouldn't have told us about the importance of all of these things, you know? Like, I don't know if my mom took vitamins. I don't know if she, you know, practiced good health things. I don't know because I never had that conversation. Have you ever had that conversation with your mom when you was younger?
No, I haven't lived with my mom though since I was, you know, 14 or 15. So
Yeah, I get it. So, the only thing that you could do in this situation, start writing things down that you feel, you know, like if you notice that this period is different from all the other ones you've had, start writing those symptoms down and checking those, and talking to your doctor and discussing the necessary things, because you might need to watch something. Like for me, I told you I have fibroids. So every year I have an ultrasound so that I can see if the fibroids is growing, if I need to remove it, is it pushing into my other parts, because I do have a lot of pain, and sometimes the pain can be unbearable, like you just have it out of nowhere and it's like, damn, do you have pain like that ever?
Only like lower flank pain, like what I
Mm.
was mentioning earlier about having kidney stones. So
Oh,
I've had that happen to where it's real bad and I'm going to the hospital trying to find out what's going on.
you've had kidney stones?
Yeah, twice I actually had, they do like this laser surgery. It's a 1 day surgery where they like put you to sleep and then they use lasers to break down the stones from the outside.
Oh wow, really?
Yeah. And it's still painful though
Heard
because
that's
it's like,
painful.
yeah, it's like somebody's like beating on your, you know what I'm saying? So when you wake up and stuff, you sore, but
Wow.
um I got I had the first time and then my kidney stones came back, but after I had the second one, I haven't had that problem anymore.
How long did it take the second time to come back?
Ooh, I want to say maybe like the next year.
Dang. And did they tell you like how many was in there?
I believe it was just one both times. Like,
Dang.
um, they base the surgery on whether or not you can pass it through. So if it's a certain, like if it's a certain size, it's too big to like pass through like your urethra and all that, then
Mm-hmm.
it'll just they'll that's when they'll laser it to break them down to pieces so that when they do come out, because when you pee out a kidney stone, it's very painful. Like it'll
Really?
break a grown man down. Yeah.
Oh.
So the laser breaks it down into little, like same way you would break down a boulder into little dust. You know what I
Oh.
mean? It
Wow.
breaks it down like that so that it can pass through and it is not painful when they
Did
pass.
you why that happens? Like what are they from?
It could be hereditary, and my mom actually had told me that that runs on her side of the family.
Mm. That is crazy.
So so
See,
that's another thing about history. Like you got, like you said, you don't know nothing about your history. Mine's either. Like we
mm,
know our dad died of cancer. That's about it. I know my grandmother died of cancer, but we don't really know stuff. And it's important that you know these things because you might die of something that you don't even know
yeah,
running your family.
yeah,
Yeah.
definitely. I don't even know any of my stuff. Like I just know what I know from my older sister. Like we talk about our health, now. And that's because things are happening to us and we like, oh, well, do you have this problem or do you have that problem? Like we just go back and forth. Like I don't even know um if all my sisters have fibroids or not. I know my older sister did, but I have them and I've had them for a while. And besides my heavy periods and my painful periods, I don't really have no outside pain, like every once in a while I'll have some sharp pain, but it's not like constant, but it is harsh on my period. And it's like PMS twist you up and have you thinking that you in menopause or perimenopause, because it's gonna be kind of the same symptoms. Like um, right now, I don't think I'm really in perimenopause. I think I'm more PMSing because my attitude has been toe up, and it's been like days that I don't even have no energy, no strength, or no want to be around anybody. You know what I'm saying? Like it's just like anything can flare my attitude, like on edge all the time, and even for no reason. Do you ever feel like that?
Yeah. But I think that have a lot to do because I don't really have regular periods. I think that have a lot to do with like depression and mental health,
Yeah.
stress, things like that.
Yeah. I do know that because of those painful periods, I have bad anemia, and when my period is gonna come, I'm like really, 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 really tired and really, just drained. Like, and it happens like overnight. It's not a sense of like this whole week I've done something and I'm just wore out like that. I'm not talking about that tired. I'm talking about just being like straight drained like this, like, oh my god, I just can't move, I can't get up, I can't do nothing. And imagine working like that, you know what I'm saying? Like, it's not easy to do that daily. So you have to be up on your vitamins, you have to take your iron, you have to know what works for your body, because what works for my sister ain't gonna work for me, what worked for me ain't gonna work for you. Do you take vitamins daily?
No,
Not none.
no.
You probably should start, because
Yeah, I am. I had already planned on it.
yeah, I just I took the kids earlier today to Jamba Juice, and they was laughing at me because I was drinking that grass, and I'm like, man, I need some energy. I just really need some energy. It's just too much this week. I just want to leave you guys with a message about how important it is to love yourself and to pay attention to spending some time with yourself and taking care of you, because while we all busy throughout the week doing what we do for the kids, or for the job or whatever we doing, you have to take some time out to worry about you. You have to take some time out to know the things you need to know about your body and have those talks. If you a mom, you a dad, have them talks with your kids, because we know that ain't nobody else gonna talk to them and tell them the things that we gonna tell them. So if you a dad, talk to your kids about all those problems, those hormones, and all the stuff that they gonna go through, that they gonna go through, because most people know certain things before they kids even think about knowing it. But you need to enlighten them on those things. If you talking to your daughter, we got parents out here that don't even show their kids how to use a damn tampon or a pad. Like, you gotta talk to them about those things. You gotta show them, okay, I need you to understand. I understand you having sex now, but I want you to be protected. So I don't care how much he love you, she love you, you need to make sure that you use this condom and you protect yourself. So make sure that we all doing the right things and we saying the right things and having the necessary conversations with our kids, because it starts at home. And in order for me to protect my son, you to protect your daughter, we all got to do our work. You know what I'm saying? We got to put it together. And if we got to do some searching, if you got to get on the internet and research some things because you don't even know it, then that's what you need to do. You need to probably ask them some questions about stuff and see how much they do know, see how much they do understand, because all of this stuff is going to become their life. And the things that we lack to tell them, the lack to talk about, they not going to know it. And if they hear it from somebody else, we don't know how that is presented to them and how it's told to them. So, I'm sure you've came across some people out here don't never want to have sex with a condom. Some people never want to practice safe sex. You know what I'm saying? Never want to go to the doctor and check themselves either. So you got to make sure that you talk to the right people and know what you need to do to have your safe sex, and to know about your family history, to be able to write it down so you don't forget it, because people might tell you some stuff throughout the years and you forget it because you don't think you need it right now. But you need to make sure that you know if your auntie suffered from this, and who had heart disease in the family, who died from a stroke, who had diabetes, who had all of these things, who has COPD, who died from cancer, or all of those things that you see daily. You need to see if they in your family, because some of that stuff be coming to you and you ain't even ready for it. If I know that I got family with heart disease, then I'm gonna start building my heart up. I'm gonna start taking the necessary vitamins to make sure that my heart ain't working overtime, because your heart might be able to work overtime at 10, at 20, but when you get to 45 and 50, your heart gonna start moving like this. And if you ain't taking the right stuff to keep it oiled and going, it's gonna stop eventually. So You want to make sure that you're putting the right stuff in your body. You want to make sure that you know what oils to use. If you're going to fry food, I mean, fried food ain't healthy for you at all. But if you're going to fry it, at least fry it in the right grease. If you're going to use butter, at least use a small amount. If you're going to put seasoning, don't put so much seasoning that you get a damn headache after, because now it done raised your blood pressure and you don't even know why you got this headache. You know, headaches can cause strokes because it's going to raise your blood pressure and all of those things. Eating too much sugar can cause you to have diabetes, just all of these things that you need to know. And we contribute to our health issues every day. So you want to make sure that you reverse that, you know, and do something better, make some better changes, set some goals for yourself. You got anything
Um,
to say, sis?
I'm gonna leave y'all with the outgoing message for today. Make sure you guys are following us on all social media platforms. We're on TikTok and X under LOASM 2024. That's the acronym to Life of a Single Mom. You guys can catch us on Facebook and Instagram under Life of a Single Mom with Brittney&Creasha. And make sure you tuning in every Monday night for our new episodes loaded to Spotify and YouTube. And I just want to leave you guys with this. Don't let stumbling or facing obstacles deter you from achieving your goals or going after your dreams, because no matter how many times you fall, you can always get back up and try again. You don't ever have to give up. You might have to tweak it a little bit, but you can always achieve it. And that hit home for me because I'm always doubting myself before I even get out there and try it. And I want you guys to know that that's all up here. And don't let your trials and your tribulations define where you going and what your future is going to be and what it can be. And until next time, you guys know what to do. Do your best to be less stressed and more blessed as you deal with the trials and tribulations of life of a single parent. Till next time.
Bye, guys.